Well, good morning, everyone. And once again, hope you're having a great start to your day. And we sure appreciate you guys coming on. And question and answer Friday, always fun. And I can't say that there's ever been a time that I didn't appreciate question and answer Friday. And Brahim, numero uno today, Portland, Oregon. Mike from Norland, Nativity, good morning. And we appreciate you, Rosalinda, Niagara Falls, Kevin, Oshawa, Rosa, and Rosa's from Montreal, Jerry, Nouveau Brunswick, Gloria, San Antonio, Texas, Chantal, Ottawa, good morning, Fran, Orangeville, and Sharon from Texas. Boy, we're well represented this morning. Evelyn, Windsor, Donna, Park Hill, and Yolande, bonjour. Mary, Norwich, and Faye, good morning. Ashley, how are you? Linda, oh, those Lindas from Pennsylvania. Peggy, good morning. Wendy, Markham, and Nick from our staff. And Barbara, Thetford, Wanda, Virginia, Sandy, Chilliwack, British Columbia, Deb, Motown, Derek, good morning, Cecilia, and Marilyn, Edmonton, Alberta, bright and early, Rose, Brampton, and Jeanette from our staff, Madeleine, Kippawa, Quebec. I missed Stouffville. Linda, another Linda, Nouveau Brunswick. Connie, the Laurentians. Maureen, Penticton, British Columbia. Dale, Michigan. And Lori, I always miss you, Lori. I don't mean it. Mary, New Brunswick. Leila, Werner, Francis. I'm going to say hello to Dr. McEwen. I'm just assuming she's on. Sue, Bolton, Thea. I miss people I don't mean to. Gary from Bolton. Denise, Oakville. Yvonne, good morning. Donna, Bell Valley. Phyllis, we appreciate you. Sue, good morning. And these Donnas are, there's, Kevin, back up. Renee, Newfoundland. Okay, a couple of more. Tina, yay, the Detroit Lions. Yes, they won. And Karen, good morning, Coldwater. Okay, let's go to our questions. Brenda, I did some digging, she says. And they're saying you need 150 grams of carbs a day for brain health. And I found many articles saying that is what we need. Please help me to understand this. Well, Brenda, if you're new to the program, this might be different from what you've read in those articles. But if you are someone that has been following us for a bit, I'm just going to repeat. It's repetition, okay? Now, your brain needs fuel, for sure, okay? Here's what I say about carbs. Your brain don't need carbs. If it did, it could take a piece of steak and turn it to a sugar. Did you know that? Okay? Carbs, look, I'm not saying carbs, people are never going to eat carbs. I'm not saying that. But what I am saying is carbs are way, way, way overrated. And your brain, as a matter of fact, your brain, we talked about this 1,000 times. What causes damage in the brain more than anything else is carbohydrates, especially your simple sugars and crappy carbohydrates are very destructive to the brain, Brenda. They're very destructive. And remember, Alzheimer's was pegged in 2005 as being diabetes of the brain. Sugar diabetes of the brain. Does your brain need carbohydrates? Absolutely not. I'll tell you why again. Okay? Your body's going to burn one of two fuels. You're either burning carbohydrates or you're burning fat as fuel. Those are called ketones. Okay? And your brain loves burning fat as fuel. It's a better fuel. That's why I call it changing fuels. It's eggs, meat, and cheese are rocket fuels. Turbo fuels. Logs on the fire instead of paper and twigs. Listen, for the last 50 years or more, dietitians, physicians, even gurus have said your brain needs carbohydrates. Can't operate without it. That's never been true. It wasn't true then, and it's not true today. And again, I'm not saying, Brenda, that someone's going to go through life and not have carbohydrates. I'm not saying that. I'm just telling you that the articles you read, it's propaganda. It's bias. Science has never shown that. Has never shown that. And today, we're carboholics. That's our problem. Because the biggest problem in brain is insulin. And you don't need much insulin at all when you're eating eggs, meat, and cheese. And you need a pile of insulin when you're eating carbs. Okay? And there's no real such thing as complex carbs. Okay? They're carbs. If it's a piece of bread, it's going to be sugar in 5 seconds. That is the wrong fuel, Brenda, for the brain. Now, again, I just go back to this all the time. There's them and us. Okay? There's them, mainstream everything, go look for articles or whatever, and then there are us. We're in the minority, I agree. Okay? And we're on the narrow road, not the broad road, the popular road. We're on a narrow road. And I understand that. Okay? So you're going to get a lot of mixed messages. So please help me understand this. Brenda, I love that. Ask questions. Ask questions. I will defend my position to you every time. And I had multiple years of experience in getting people to change their fuel. And the results were incredible. Incredible. And so you do not need 150 grams of carbs a day. You don't need 5 grams of carbs a day. 150, that's a lot of carbohydrates. You just don't need it. And again, if you look at who's influenced nutrition, it's the food industry and the pharmaceutical industry. Thank you. Gertie, what is the best protocol to recover from vertigo, extreme neck pain, dizziness? Well, look, I mean, the thing is, Gertie, that vertigo can be a pile of things, okay? When you tell me about extreme neck pain, well, I'm going to suggest that vertigo came from there. It certainly could be a big factor, okay? It could be a neck problem and affecting the cranial nerves, middle ear of, those crystals in your middle ear, they get out of balance. And, but I always look too at vertigo, tinnitus. I'm big on B12. Because oftentimes that can be an issue because of the low levels of nitric oxide. And nitric oxide opens up blood vessels, and blood vessels have a big to-do with nerves. They supply even the nerves. You need blood supply for nerves to work properly. So again, it could be a pile of things, Gertie. The best protocol, find out the cause, look at B12. A lot of causes of vertigo too, by the way, are viruses. Get a virus, especially if it's an acute, sudden onset to vertigo. Oftentimes it can be a virus. So antiviral, vitamin D, vitamin A that you eat in steak, and very antiviral. Probiotics. Patrick, how do we know if we're getting enough protein, especially if we're only doing OMAD? What's that? What's OMAD? And how much protein should we be eating? And I got asked this questions this morning. I need to gain weight and have been doing EMC since February. Feel good, but losing continually. Look, Patrick, look. I never ever like talking about how much protein a person needs. I'll tell you why. Okay? Because protein is king. It's the king of the castle, and carbs are the dirty rascal. Okay? So, how much? You know what? I mean, you can Google how much protein, and I've never seen people get it right. I'll tell you why again. Because protein is so good for you. Protein has gotten a bad rap, and they want to limit it, especially when it comes from the animal kingdom. And I love eggs because it's very high in protein. And usually, if you want to, like for you're asking a question, you're continuously, Patrick, losing. Well, I would probably tell you the answer is not in food. It's in muscle. And you need to develop more muscle. Okay? And again, I don't know you, Patrick, so, if I saw you, I could give you even better detail. But get strong. And if you're losing, there's very rare, by the way, like in this day and age, we're always talking about weight gain and people trying to lose weight. People that are trying to gain weight. People that are just tiny. That's the way they're built. And they lose weight. I tell them, look, you're not getting, one, enough protein usually, and two, you need to get strong. You need to build muscle. And you can be a lean, mean fighting machine. And so often I tell people, so you throw away the scale. If you're feeling good and you're strong, what does weight loss mean? I mean, if you're losing weight unexplained, plus you're feeling sick, that's different. But if you're feeling good, Pat, I wouldn't worry about it too much. And just make sure, again, I don't know you, but make sure you're strong. Build muscle. So many people have sarcopenia, even obese people, sarcopenia. They got a lot of fat, but they got no muscle. And the king of foods for muscle is protein. So, can you get too much protein? Nah. Like, I guess if you ate 30-something eggs a day, I don't know why you'd want to do that. If you're not hungry, don't eat. Some people are, they want to measure everything. That's not me, okay? Now look, I'm not telling you, look, if that's you, I want you to read labels, by the way. I'm big on that. But, how many grams of this, how many grams of this? Eat low carb the rest of your life. and eat a lot of protein and fat. The way God puts it in nature. Think about it. Eggs. You got a lot of protein in an egg? You better believe it. And bioavailable protein. It's much higher bioavailability than plants. I'm not saying plants are no good. I'm just telling you that people tell you that plant protein is better than animal protein. It's not even close. So how much protein? Well, if you're not hungry, stop eating. Usually if you have bacon and eggs in the morning, this has been proven, by the way, have bacon and eggs or sausage and eggs in the morning. In terms of your blood sugars, in terms of insulin, in terms of your cravings, in terms of almost anything, you're going to be a lot better off having a high protein and fat in combination. What's bad is carbs and fat, not protein and fat. So I'm not big, guys, on measuring. I'm not big on how many grams. And don't believe for 1 second that protein damages your kidneys. It's not true. It was never true. I've been screaming blue murder for years about that. Oh, Dr. Martin, I got protein in my urine. Or my creatinine is high. Must be eating too much protein. No, you're eating too much sugar. You're eating too many carbs. That's what kills your kidneys, not protein. But when you know nothing about nutrition, hate to say it, doctors get about an hour of in medical school about nutrition, and they believe these lies. Oh, protein, that is terrible for your kidneys. And then it 50 years later, they still believe it. And you need so many carbs for your brain to operate properly. Brought to you by the cereal companies. And cholesterol is bad. It gives you heart disease. No, it doesn't. But I'm not here to change the world's narrative. I'm not. I have no intention of changing the narrative. I'm aiming at my audience and getting them to think outside the box. Protein, I've never had a case, I mean it. I've never had a case in my office that I had to tell a person, would you cut back on your protein? I've never had a case. Now, people that, in a weight loss program, okay, let's say, okay, I want to lose weight. Well, you can't be eating all day, and lose weight. You know what I mean? And it's not calories. It isn't. But, that's why, when people struggle with weight loss, well, first of all, most of the time it's hormonal. But second of all, they're usually eating the wrong food. They got the wrong fuel. And I got to flip that on them. And I give them a high protein diet, because then they're not hungry. They don't have the cravings like they used to. And yada, yada, yada. Okay, thanks, Patrick. We appreciate you very much. Okay, Brenda, 40-year-old, has an infection in the fistula tract. Okay, now is that in the fistula tract? Did she get a fistula? Okay. Or what is the fistula tract? Okay. You can get a fistula between you get a fistula, not a fistula tract, as far as I know. And that may not be the way you phrased it, Brenda. Okay. You can get a fistula. I know what a fistula is. And that can be, I've seen it between the colon and the anus. I've seen it in the bladder, between the bladder and the vagina. That's a fistula. And you get an infection. Yeah, you can get an infection. And the best thing is probiotics and oil of oregano. That combination. Probiotics and oil of oregano. That's what I like. Mary, does too much B12 cause histamine levels to rise? Absolutely not. Okay? Absolutely not. Now remember about B12. Okay, Mary? B12 is a water-soluble vitamin. You don't accumulate it. It doesn't build up in your body and become toxic. It just doesn't do that. Okay? Now, if your B12 levels are optimized between 800 and 1200 is where I like them, and you get to that area in terms of blood work, then you can stop taking B12 and just eat red meat. Okay? But B12 never, ever causes a histamine to rise. Okay? A histamine response, is usually comes out of mast cells when you're developing some kind of either autoimmune or, developing allergies, and they can come out of nowhere. But I've never seen it in response to B12 ever. So, out of the blue, 8 months ago, I developed, but that's the way things are, Mary. Out of the blue, allergies come for a lot of people that had no problems. So be Dr. Mary. See if there's any foods that bother you. See if anything in the environment. You got to be your own doctor there. But usually it's because, Mary, what will elevate histamine is leaky gut. So you might have developed leaky gut. You might have not have had it before, or you had no symptoms before. And I look at the gut more than anything else that has developed. Okay? Thanks, Mary, for the question. Anna, could we discuss oxalates? Well, sure. You can actually Google high oxalate foods, okay? One of the reasons, Anna, that I take people off fruits and vegetables for 30 days on the reset, one of them is oxalates, okay? Now, if someone gets a kidney stone, for example, okay, 75% of kidney stones are oxalates. 25% are uric acid. And all I'm saying is, okay, when you look at oxalates, per se, they're not bad for you. But if you got trouble filtering, your kidneys are not filtering properly, well, that can set you up for kidney stones. But not only that, I talked about this in my new book, Sun, Steak, and Steel. Okay? See that? See that? Sun, Steak, and Steel. Okay. I talk about oxalates in there. And I talked about it in my last book, too, the metabolic syndrome and the metabolic reset. I talked about oxalates because oxalates are often found in breast tissue. And that's not good. Okay? That's not good. Again, it's not all food, because ordinarily your body can get rid of oxalates. Okay? But what are oxalates, by the way? Little glass. They're like they're crystals, and they're glass crystals, oxalates. Kidney stones, gallstones, breast tissue, oxalates. So, yeah, I mean, it all has to do with whether your body, Anna, can filter out the oxalates or not. Okay? And if not, I'd be very careful with that. Good question. Thank you very much, Anna. Here's another one about B12. Should B12 supplement be taken with food? Mark's asking. Can it be dissolved under the tongue just before a meal? Absolutely. Look, B12 is water salt. Look, I don't know if I necessarily buy this or not. Okay? When you have a fat-soluble vitamin A, vitamin D, vitamin E, vitamin K, ADEC, those are fat-soluble vitamins. And you'll get a lot of gurus telling you you got to take a fat-soluble vitamin with a meal because it's going to be absorbed better. Look, I'm not saying... I don't necessarily just buy that, okay? Doesn't mean I don't... I'm not going to die on that hill. If you want to... But B12, that don't matter. Absolutely doesn't matter because it's a water-soluble vitamin. You can take it before, after a meal, doesn't matter. And you're not swallowing it anyway. B12, the biggest thing, because somebody's asking this question too. I saw it. Hold on a minute. Let me get to it. Somebody asked. Teresa, I'm going to answer your questions right now, Teresa, too. Okay, is vitamin B12 spray better than tablets? Well, it doesn't matter whether it's in a spray or it has to be, though, in the right form, meaning it's methylcobalamin. That's the key to B12. Secondly, B12 cannot be swallowed. So if you're taking a multivitamin and it has B12 in it, you ain't getting B12 from the multi. You might get other B vitamins, but you're not getting B12. B12 is a large, finicky, structural vitamin, and at the best of times, it's not the easiest. That's why, and this has been proven, that taking a sublingual capsule that dissolves in your mouth, okay, tablet, not capsule, tablet, or a spray, a B12 spray that you just spray in your mouth and you don't swallow it, is even more effective than a B12 shot. I've always preached that, by the way. And B12 shots, I'm not against them. I like them. I do. But it's better to take B12 every day. And it actually will top up. I can prove this. Studies have proven it. And I saw it in my own office. The people that take B12 every day in a sublingual form, and by the way, I take B12 every day. Okay? I do. So the key is methyl. Make sure it's the right B12, because otherwise your urine's going to be expensive for nothing. If it's cyanocobalamin or whatever, it does not absorb in the body. Okay? It has to be in a sublingual form. Okay? And I like the higher amount of B12. Okay? I like, ours is 4,000 micrograms. Used to be 5, but Health Canada didn't like that. Okay? So, anywho, Yeah. Okay, I think I answered your question. Hold on. Okay. All right, that's B12. Yeah, there we go. Thanks, Mark. Judy, my husband was taking hormonal support. Can he take the menopausal formula? Well, yeah, that's to elevate progesterone. So, no, I wouldn't recommend the menopausal formula. But with the hormonal formula, and we're just praying it's going to be back to a theater near you very soon. Oh, anyway, I don't want to get into it. Get your hubby on flax seeds because of lignans, and lignans will block any estrogen. I put more men on lowering estrogen formula than women. Because men have more estrogen than their wives. And that's what affects the prostate more than anything else. Okay. Judy, thanks for the question. Any idea why gelatin is not on the okay list for the reset? Well, you can, like, are you talking about bone broth gelatin? Are you talking about making your own gelatin? Lori, from bovine, or what are you talking about? Gelatin's all right. I got no problem. Do you mean it as a supplement, or do you mean it as food? That I'd need to know, but I got no problem with it. It's animal based. Okay? Eggs, meat, and cheese. Eggs, meat, and cheese. I don't remember, Lori. Is there anywhere that I said you can't have gelatin? I don't remember that. I'm a senior. Maybe I might have said it. I can't see that I would have. If I did, I made a mistake. Kathy, what does Dr. Martin suggest for cold sores aside from keeping up with vitamin? Well, look, cold sores is the herpes virus. It's usually asleep. We all got herpes when we got chickenpox. And it'll only raise its ugly head, herpes simplex, which is cold sores, or herpes zoster, which is shingles. When, look, the best thing to keep that down, yes, the immune system, eat vitamin S, lay off the sugar so you don't hinder the work of your white blood cells to keep that thing at bay. And I love probiotics. I love oil of oregano. I'm big on that. Even on a daily basis, I really love that antiviral and stress. Because usually cold sores, it's a perfect storm. Stress. Shingles, perfect storm. Stress. It's the straw that breaks the camel's back, if you know what I mean. So get cortisol down too, because that has an effect. Thank you very much for the question, Kathy. What causes, another Kathy with a K, the other one was with a C. What causes macular degeneration? Blood supply, blood supply, blood supply. Your eyes? Blood supply. Kidneys? Blood supply. Why do you think diabetics have so much trouble with their eyeballs? Blood supply. Sugar damages blood vessels. Sugar damages blood vessels, and it starts with damaging capillaries. And that's why it's not protein that damages your kidneys, it's sugar. It's not protein that damages your eyes, it's sugar. Why do we see so much more macular degeneration today than we used to? Not that it wasn't always around, but it's a lot worse. Why? Sugar, my friend. The 200 pounds of sugar a year that people consume, and they have no idea that they consume that much. It's the average. But your body was never, ever, ever meant for that. Okay? Now, to rehabilitate macular degeneration, it's amazing what your body can do. You cut out sugar. Oil, oil, oil. Blood vessels need lubrication. High DHA oil for the eyes. Blood vessels need nitric oxide, B12, Navitol for the eyes. Amazing. Some of the things that I've seen over the years, Kathy. Okay? Michelle, my friend has osteoporosis. What should she take and do? Get strong. Muscles are one of the keys. We talked about it the week before, last week, maybe. Muscles, muscles, muscles for bone. Ladies, why are you more susceptible to osteoporosis? Yeah, I know your estrogen goes down, but it's not that. It's muscles. You need to get strong. The stronger you are, the better your bone responds. Your muscles anchor into the bone, and as they do, your bone strengthens. They work synergistically together. Bones and muscles work synergistically together. They have a love relationship if you get strong. Your bones will appreciate it. Lay off the sugars. And bones love eggs, meat, and cheese. Because I've talked about this. You need vitamin K2 for your bones. Yep. And vitamin K2 is found with your calcium in nature because God wanted you to eat eggs, meat, and cheese for your bones and for everything else too. Okay? Now you're not going to hear that everywhere. You're going to be told to take calcium with osteoporosis, and I tell you that's a big mistake. You don't need calcium. You need vitamin K2 and eat your calcium. Don't take it as a supplement. It won't get to its intended destination. Now, I like vitamin D, obviously, with vitamin K2. Supplement with vitamin D and K2. Put them together. Eat eggs, meat, and cheese. And, okay, let's see. Okay. Michelle, thanks for the question. And what does a young person having psoriasis for years get psoriatic arthritis in the knee, painful and debilitating? Well, I'm going to tell you 100%, Dan, 100%. That young person has leaky gut. You do not get psoriasis, eczema, without leaky gut. Leaky gut, leaky skin. Then it'll get leaky gut, can go to leaky joints. It's autoimmune. It started in the gut, oftentimes after antibiotics. And the microbiome got shifted. And you got more bad guys than good guys. And yeast came into the equation, that invasive army, and it spread in your bloodstream and it went to the skin and then can get into the bones. You got to go back to the start of it. Leaky gut, fix that. Change the diet. Get off all sugars. No sugar. No sugar. No crappy carbs. Because those are very inflammatory too. Okay? Okay. Thanks, Ann. Dale, I do not drink coffee. Dale. Why not? And I am wondering if it's okay not having vitamin C for 30 days to do the reset. Google said eggs, meat, and cheese do not contain vitamin C. Well, Google is wrong. Okay? When you eat eggs, meat, and cheese, you ain't missing any vitamins. Not one. You get a trace of vitamin C. Vitamin C, guys, why do you think I named coffee vitamin C? Because vitamin C, ascorbic acid, is way overrated in my opinion. Not that I don't like it. It's just overrated. What did I say about Linus Pauling, who won a Nobel Prize in medicine on his research in vitamin C? He only missed by one letter in the alphabet. Vitamin D. Okay? Guys, I know I got a sense of humor, but I mean it. I'm serious. When you eat eggs, meat, and cheese, you don't need to take any vitamin C. You got what your body needs. You'll never get scurvy. Never. By eating eggs, meat, and cheese. Never get scurvy. A lack of vitamin C. Okay? You won't. Now, okay? Coffee per se does not contain vitamin C. Okay? Because some people think I've said that. No, I'm not saying that. What I said about coffee is coffee has 1,000 phytonutrients. Okay? I tell this story all the time because I'm big on pine bark extract. I have been for 40 years. When Jacques Cartier, if you know the history of Canada, apparently he's the one who named Canada, Canada. Jacques Cartier. He was a French explorer. 25 of his men died from scurvy. And he wrote that after the natives, the First Nations, befriended him when he come up the St. Lawrence River, they gave him a tea. Too bad they didn't have coffee, but they gave him a tea with pine bark extract in it. He wrote it down. And he said, holy moly. Well, what's pine bark extract? It doesn't have vitamin C in it. It's a polyphenol. It's got a multitude of antioxidants and phytonutrients and whatever. Not specifically vitamin C. Okay? So, again, I just, look, here's where I really like vitamin C, by the way. Okay? So, don't think I don't like the other vitamin C, not coffee. Okay? I like it in very high doses intravenously. Okay? Someone has cancer, and you can get intravenous therapy with not only vitamin C, but I like vitamin C intravenously. You couldn't take that much because you'd get diarrhea if you just swallowed it. But intravenously, I like it. I've seen some good research on it. Okay? So it's not that I'm against vitamin C, guys, but when you do eggs, meat, and cheese, you got vitamin C in there. You got traces of it. That's all you need. And you're never going to get scurvy, and you're going to feel better, and you're going to get all your amino acids, and you're going to get everything. Okay? Okay. Thanks for the question, Dale. Cecilia. Just wondering if the iodine in the thyroid control is enough for women. Yep, it is. Because it's a very good iodine. But listen, this is really important, Cecilia, that I tell you this. Oh boy, am I ever talking too long. Very important I tell you this. Thyroid is not only dependent on iodine. Okay? That's why I'm very big on selenium. You know where you get selenium? In steak. Your thyroid doesn't work without enough protein. And not from the plant kingdom, the animal kingdom. It's one of the big reasons that women, more than men, have trouble with their thyroid. Okay? Now, there's a lot of other things. I've talked about that for so many years. But I'm telling you, you make a mistake just taking iodine if you're not eating steak to get your selenium. But if you look at our thyroid formula, that's a perfectly balanced formula for the thyroid. Thank you for the question. Cheryl, last Friday you mentioned you have seen reversal of hardening of arteries. Yep. I have, I want to be prepared for an ultrasound test next week on my carotid artery. What helps keeping blood vessels? Well, Cheryl, okay. In 1 week, you're not going to change anything that's going on right now, okay? But here's how to keep your blood vessels. Well, I talked about it the other day, vitamin D and vitamin K2. K2 is so good for heart disease, eggs, meat, and cheese. Okay? And vitamin D, because it elevates nitric oxide. Lubricate. Your blood vessels need an oil change. High DHA oil, in my opinion. Omega-3, yes. DHA, the best. Lubricate. Butter, lubricates. Oil. Okay? Oil, good oil like butter doesn't clog your arteries. It lubricates your arteries. Lubricate. Okay? I don't know nothing about my car, but I know I got to get an oil change every once in a while, because even my grandson told me the other day, he's a mechanic. You know what he said? Grandpa, what happens to old oil? I said, the oil is, no. He said, change your oil. That's a good idea. I said, why? Tell me why. Well, older oil, you know what happens? It loses, it thickens. And that's not good for your engine. Or it loses its viscosity, thickness. It thins out too much. You want good oil. Okay. I said, okay, change your oil. Omega-3. Okay, thanks for the question. I think I only got one more. A couple more, and I'll do this quickly. Colleen, I can't take a probiotic. Well, look, listen, what can I tell you? There's 8 billion, there's 8 now. There's not 7 anymore. There's 8 billion. April, it happened. We hit 8 billion on the planet. You're different, Colleen, than anyone else on the planet. People that can't take probiotics, like out of 50 years, did I meet 1 or 2? What do you mean you can't take a probiotic? Well, then take fermented foods. It's not like a broad spectrum probiotic, but it's better than nothing. Okay? Better than nothing. Drink some pickle juice too. Okay. Okay. What does Dr. Martin think about electrolyte powders, Yvonne? I like them. I like electrolyte powder. I like electrolytes. And every individual is different. Put some salt in your water, guys. I always recommend. That's electrolytes. Salt in the water, like a Himalayan salt or a Celtic salt, a good salt, a real salt. Put a pinch in your water and you got electrolytes. I personally need a little bit more electrolytes. That's just me. Okay? I don't know if it's because I'm getting older or whatever. I like electrolyte powders. Okay? I do. And you need, in an electrolyte powder, you need sodium, chloride, potassium, magnesium. Okay? Those are electrolytes. Okay. I think I answered. Oh, ginkgo, Janet. Last question. What do I think of ginkgo? Look, I like it. I've seen some research on ginkgo. In my clinical practice, it used to be a guru years ago. Again, guys, there's nothing that I didn't try in my office, okay? I can't think of anything that at one time or another didn't cross my desk, either in samples or whatever, to try on patients or whatever. You got to understand, people used to I had a radio show for 20 years. And ginkgo was, it was the cat's meow for a while. And I just didn't find clinically for me, I like some other things better for the brain than ginkgo, for me, okay? My experience. You're asking me, so I got to tell you. But it's not that I don't like it, okay? It's not that I don't. I've seen it. Some research in depression, for example. But again, me clinically, I never really got the results that I liked with my patients with ginkgo, okay? Okay, guys, we love you dearly. You know that, right? Okay, we'll talk to you soon.